Well, as we mentioned at the top of the hour, the Obama administration issuing these new rules this week requiring insurance companies to cover people with pre-existing medical conditions. Just one of the big changes from the health care law now going into effect. But actually, you got to dig really deep here. Look at these new regs. It could affect coverage for millions of Americans, and that's what we're going to do with Dr. Marc Siegel, of course, a professor of medicine at NYU Langone Medical Center, also a member of the Fox News Medical A-Team. Doctor, great to see you as always. All right.
Good to see you, Greg.
Some of these new regulations define essential health benefits. What is that?
Well, it basically, as you said in the setup to this, it's not going to allow you to be excluded for pre-existing conditions. There's two parts to that, though. First of all, they have to insurance companies are going to have to provide coverage for you no matter what. But the other side of this is they can't automatically raise your premiums by a lot if you have a more chronic illness, if you're older, if you are female versus male, if you're a smoker. The most they could raise your premiums if you're old, let's say over 60 years old versus a 20-year-old, is 3 times the premium. Yeah. In most cases, premiums are going to have to be the same. And you know what that means? In New York State, where we really already have a roadmap for this since 1993, it means the highest premiums. We pay the highest premiums in the country here in New York State, over $6,000 per individual, over $13,000 per family, twice the national average. So we're getting bells and whistles here, but you're going to have to pay for them. There's just almost no way to keep premiums down if you're going to not only cover pre-existing conditions, which is very popular, but do it in a way where you don't pay more if you're sicker.
Are employers going to kick their workers off programs and put them onto the government exchanges?
Well, I'm concerned about that. I think that employers of over 50 employees may, in many cases, decide to pay the penalty. There's a positive thing going on here, though, with the regulations that I want to mention, which is employers are being allowed a greater incentive for employees losing weight, lowering blood pressure, lowering cholesterol, and stopping smoking. You can get up to a 50% reduction in your cost of your premium if you stop smoking. I really like that, but that, again, is money that's going to have to come in terms of federal subsidies out of the taxpayer's pocket.
What about limiting deductibles?
Well, I have concern about that, too. The regulations also say that the most you can charge in deductibles in a regular policy for an individual is up to $2,000, $4,000 per family. Greg, I have always felt that deductibles are a good thing if you're healthy. You know why? The worried well are less likely to come to see me. If they're hit with a deductible, they have to pay out of pocket. Paying out of pocket is a disincentive for overuse of insurance. Obamacare decreases that incentive. They say, well, we don't want people to have to pay out of pocket. But around the world, in countries that have universal health coverage where people pay out of pocket, they overuse insurance less. So I think that's a bad thing. Now, if you're really sick, you shouldn't have to pay that deductible, granted. But if you're well, I'd like that deductible to stop you from overusing insurance.
There's still going to be, according to the CBO, Congressional Budget Office, nonpartisan, almost 20 million Americans who will, Obamacare notwithstanding, remain uninsured. Does that mean that the entire goal of covering all Americans with insurance will be unmet?
Well, I wouldn't say the entire goal, but I'd say a large part of the goal will be unmet. And again, the other thing that's concerning here is that everybody's going to get this comprehensive type of insurance they may not need. One of the ways Obamacare works is by getting your 21-year-old to sign up for something that they may not need. They may not need all these bells and whistles. It's really better for somebody that's a sick diabetic or with heart disease. And as you said, and not only will the 20 million not be unmet, but also we're not covering illegal aliens. They come into the emergency rooms. Hospitals have to
stuck with that.
Absolutely.
The government has to reimburse some of it as well. So it goes on and on. All right. Dr. Marc Siegel, happy Thanksgiving. Thanks for dropping by.
Happy Thanksgiving to you. Good to see you, Greg.